Oh, perfect. Thank you. Okay. So just a quick agenda that we're going to be going through today, just CST guiding principles of design and our purpose for the session today. A very quick high-level enterprise workflow of what ambulatory clinics follow within CST Cerner. We're going to review your forms that you have sent to us, and then just with some follow-up questions for you, okay? So just guiding principles of design about CST, the Clinical and Systems Transformation Project transforms healthcare systems and processes to improve the safety, quality, and consistency of patient care. The health facilities involved are VPP, so they cover Vancouver Coastal Health, Provincial Health Services Authority, and the Providence Healthcare. Our design approach is centered around the guiding principle of enterprise design. So you'll hear that word a lot. This essentially just entails configuring the system to effectively incorporate all of the health organizations and standardize the processes. So the must-haves essentially for enterprise design is guided by this. Specifically, changes to the system are only implemented when the following 4 factors have been taken into account, such as safety, regulatory, financial, and content. So the purpose of this session is to review the workflow, as I had mentioned, identify any requirements, and review the content that already exists in Cerner, and identify any gaps that will help support your workflow. Any questions so far before I move on?
No.
Perfect, thank you. So just a very quick outline of what ambulatory clinics look like within Cerner. It's just kind of like a diagram that moves forward here, starting from a referral that's received, which is then screened, accepted, the appointment is scheduled, it's confirmed with the patient, and then the patient checks in and registers on the day of the visit, and you have documentation from the nurses, as well as allied health as yourself, as well as the providers, and then there's follow-up patient departure steps as well. So the next few slides kind of outline these again in a little bit more detail. Is there anything specific about this workflow specifically that you'd like to go over? Otherwise, I can just jump to the allied portion of it, which is your documentation.
Yeah, I think that's fine.
Okay. So it's pretty standard. It does follow your workflow pretty well. And we did discuss all the different nuances in terms of screening and triage and scheduling the appointment with the previous group. So please feel free to refer to those minutes as well if you have any questions. Otherwise, in terms of the documentation, the allied health member just sees the patient that has arrived either physically or in the system through ambulatory organizer. And this is a screenshot of what that would look like, when you do log in. You have the ambulatory organizer tab, and then you can have a list of your patients for the day. The documentation of the clinic and task specific will be documented either via Power Forms, interactive views, or dynamic documentation, which we'll go over in a minute here. Okay. So forms review, just jumping right along. So we have the patient-specific functional scale form that you had sent in to us. So there is no exact CST Cerner equivalent of this form. However, there is a functional independence measure power form. We did also present this to the OT in our other group for the transitional pain clinic design session. And we are recommending either form fast, so keeping this form as a paper form, and then you're just filling it in as you normally would, which will be then later on scanned into the patient's chart. Or you can create an auto text, use the auto text functionality within the system, which is where you can kind of configure your own note and include all of these portions in it, and it just kind of copies the same outline and the same template, but it's already in the system as opposed to having to scan this document in afterwards. Do you have any questions about what those two options are? Or
No, I guess the question was just, so would you just have like a chartlet and then it gets scanned in at the end of like when the patient's discharged, or is this something that would be scanned in kind of regularly?
So the pain clinic did request for a scanner. So you will receive a scanner that the clerk will use to scan directly into the patient's chart. So it can be quite quick.
Okay.
It doesn't have to be at the end of where the chartlet gets sent down to be processed.
Okay.
So it can be quite quick, but then again, that will be reliant on whether or not the clerk how fast that happens, considering all the patients that you do see. So that would be the delay if there was one.
Okay.
Yeah. So yes, so that would be if it was a paper form still, and you keep it that way. Sorry, my apologies. I don't recall what it was that we had recommended, or what the OT was leaning towards from our previous session. Did anyone remember what that was? I can look it up afterwards, and we can connect about whether or not you guys want to share the same kind of decision regarding this form, because I believe you both use it.
Mm-hmm. I'm thinking probably auto text would be easier just to type it in there, but yeah, we can double check. I'm guessing Alex would probably think the same thing.
Yeah, auto text would be good. Do you need it to be in this chart format where you see all of them like simultaneously? Because the thing about auto text is it's going to save as like a new document.
Mm-hmm.
So I don't know if you like this consecutive look to see. It looks like you're charting on the same form multiple visits.
Yeah.
So that's the only thought that I have, if you care to have it in that format.
Yeah, that's a good point. Maybe I'll just, I mean, I guess the only part is just to compare it, but I guess if you had it saved with a title, it would be easy to just pull it out. So
Yeah, you would have to, yeah, you could look at other different documents that are saved.
Yeah. So maybe I should just double check and make sure that's not an issue with the form itself, but I can't imagine it would be.
Okay, sounds good. And then I'll just quickly look at the notes real quick, Love, while you're going, and seeing if I have any notes about what OT thought.
Okay, thank you. And
Hi everyone, it's Andra here. I just want to point it out that this form, the patient-specific function scale, is also used by the 5 clinics that are going live at VGH.
okay.
And that clinic is requesting this to be on FormFast. So there is a ticket already that requesting this form specifically to be on FormFast, just for you guys to know. I can put the ticket number in the chat.
That's okay. I think so it sounds like, Sarah, most people are leaning towards keeping it on paper and not doing the auto text.
Okay, and maybe you want to be consistent. Okay, maybe I'll just check with Greg then and see if he wants us to be consistent. I'm not like too attached either way, so that would be fine.
Okay, so but maybe we'll lean towards the FormFast version unless we hear from you that there's a real desire to explore the other way. Okay, sounds good.
Okay,
Thanks, Love.
Thank you. And just for my understanding, Sarah, do you have previous experience with Cerner, or is this kind of the first time you're seeing the system?
I do, yeah.
Oh, okay, perfect. Great, so let's move along. The next form here is the transitional pain assessment. So the categories that are highlighted in the red boxes, we did a crosswalk of this form compared to what was available in Cerner, and the ones in the red boxes are currently not in anything that we have that's directly equivalent. So a lot of it's pretty much half the form here. Some of it is available as a power form, the PT initial assessment power form, as well as the reassessment power form. So again, this would be different recommendation or different options that you have. So either a combination of documenting in those power forms with sections that are available, pardon me, and or a combination of half of the power form and then half a dynamic doc, or keeping it as a regular Dyne doc with auto text template, or a new power form. which again would require a decision as it can be used by other sites. So I don't know if you want me to show you what the PT initial assessment power form looks like.
That I'm familiar with that. It's the ad hoc one, right?
Yeah.
And is that the inpatient one or?
I believe there is one separate for outpatient.
Okay.
Yeah.
Sure. I don't think I've seen the outpatient one. I think that, if you don't mind pulling it up.
Sure. PT outpatient initial assessment. Pardon, my screen is a little tiny here. So it has the reason for the consult, general information, problems, history, which can be pulled in from other sections of the chart, living environment. So is there a specific section you would like me to click onto?
Oh, no, that's okay. I just wanted to see what it looked like, but I guess it's kind of similar to inpatients, just has some other things in it. Okay.
Yeah. So based on this power form and the one that you had sent us, these are the red boxes that are missing from it.
Okay.
So the complications, post-op, sorry if you can't, it's too tiny there.
It's okay. Yeah, I can.
Yeah. And then there's no diagram as in the form as well. So
Okay.
yeah.
So I think OT's perspective of this one was that they would utilize the power form. And then they would, I think there's in the power form a free text area to add the additional information, or they were going to put it in a note for the ones that were missing. So that's, I think, what OT had thought of. And then they wanted to request that recreation or leisure be added as a tab on the side because they believe that that is one of the ones that are missing, but that would be maybe important to incorporate for multiple areas. Is that not the same form we're talking about, Love? The recreational leisure part?
I think OT has a specific one for the recreational and leisure because I don't see that as one of these boxes.
Yeah,
Oh,
the OT has a different assessment form.
Got it.
When I used to work at the complex pain program at St. Paul's, and I think the form was kind of similar, and I think we had just decided at that time it was form fast. It was just put into form fast and then printed and written on, but that was kind of before, that was like 2.5 years ago. So obviously there's been a lot of changes since. So I was wondering about maybe doing auto text, but then I don't know about doing a diagram or something. You can't really put that in there, can you?
In the auto text, I don't know. Is someone on the phone? Can you put diagrams in an auto text?
Yeah, hi everyone, Zandra here. No, you cannot.
Okay.
I guess the question is whether or not you want to leverage like the power form and an auto text or just an auto text, but regardless, you'll still need to have at least the diagram pulled out, separated.
Okay, so I could do like an auto text and then have the diagram just like print it off and put that in the chartlet. Yeah. Okay, that might work. I feel like just the issue that we had with just having everything like in form fast and printing it off was just we lost that communication piece with the team because everything was in that little chartlet, but the doctors, didn't really need the chartlet anymore. And so it was a bit harder to communicate or to have them read our notes.
Right. If it was the auto text template, it, as you know, you can pull in, for example, the past medical history, things that are already in the chart, but then you can also add your different sections that you would like to document within, and it's already part of the patient's chart. And then the providers can actually go into your note and kind of tag it or copy from your note to add. So it is just the picture part that's kind of missing. So in terms of combination, I think it would be best to kind of limit to two, potentially just auto text and maybe just this diagram.
Yeah, I think that would work. Yeah, I think that's a good idea. Okay.
Any concerns from the team about that? And if we're moving too fast, please let me know. I can always go back to a slide.
I guess my question for Andre would be, what are they doing in outpatients?
For this form specifically?
Well, they wouldn't have this form, but for their form that they do.
Yeah,
Sure.
for the clinics that I'm working with, the 5 clinics for the VGH, they do not have a similar form.
Mhm.
So yeah, so the forms that they have any diagram will keep on paper.
As in like put
Yes,
it in form fast?
it's some of them on Form Fast and some others no, because like they do a lot of for burns and they do have kind of a lot of diagrams for hands and foot and things like that. So those ones will be kept on fully on paper, not even at Form Fast, because there are some issues with where they get that form from. So this one that I'm looking at it's from Vancouver Coastal. So it's up to you to, if you can do half of it without, or like 90% of it without the diagram as a auto text, and just put that diagram there. Yeah,
Okay.
yeah. But that's a good question. Yeah. So like, let's say for arthritis that it will be going live in the future, they have lots of these type of forms. So there is a dialogue how that can be incorporated into center. So maybe we can add this one for that bucket when it comes.
Okay, that sounds good.
Thank you. Your phone intake checklist. So again, possibly just a note and the use of auto text would be our recommendation or suggestion. What do you think about that?
Yeah, I think that sounds good.
And just as an FYI to you, during our presentation with your colleagues, there was quite a bit of their notes or their forms as well that are probably going to just be a note, a DynDoc note with auto text. So this isn't, if you're a little worried about them using a lot of that, I think the majority of the forms for the clinic will be a DynDoc.
Yeah, okay.
So this one, I believe it was just the SOAP chart notes.
Yeah, this one I don't think it will be an issue. This is just how, like when I had to chart online, how I've been doing it, but this I think will just be fine in the documentation. I don't think we even need this.
Oh, okay.
Yeah. I mean, that would be fine. What you have there was great, that template.
Yeah. So this was just a slide in case you hadn't seen the system before and how these worked. This just outlines or kind of shows an example of what auto text templates look like.
Yeah.
So you're familiar. So great. And then that's the last form that does involve you would be your interdisciplinary discharge form, where it's a multi-group contributor form. And this, Amanda, do you mind jumping in about what?
Yeah, so this form, we were going to explore the option of possibly building out a multi-contributor power form, but that doesn't seem like it will probably best suit your needs. We also did explore some other options that are being explored for other clinics for multi-contributor, for instance, like different notes. But honestly, we believe that the best thing for this would be probably to remain on paper, just because you kind of go so back and forth, and because the final person is not necessarily always a provider who fills out this form. So a lot of the workflows with a multi-contributor rely on the provider being the final person to actually pull this information together.
Okay.
So since that doesn't really match your workflow, and it could potentially not be the provider that has the final input on this form, it's probably best to keep this one on paper. Otherwise, it's a pretty convoluted workflow, and it kind of requires your clinic to actually change your workflow, which is working right now, to accommodate this.
Okay. I guess the question is then, do we have to do it by hand or can we still type it? Because right now we
No, you can still type it.
Oh, okay.
So you can follow your current state if that's working and if that's appropriate. And then just at the end, print it off and like scan it in.
Okay, perfect.
Mhm.
Thank you. Were there any other forms, Sarah, that that you can think of right now that we hadn't covered? Those were the ones that I had received.
Yeah, I think
Whenever-
I just sent you those ones. There are some other outcome measures, but they would also be used by like the outpatient department who are going live. So I didn't bother including them because I don't use them very regularly. So I know that there's like, I think there's like the Berg is maybe already on there.
Yeah,
But sorry.
Sarah. So the Berg's already being created a standalone power form for the Berg itself.
Mhm,
So we do have also in iView the critical frailty scale,
okay.
and quick dash is going into form fast, dash is going into form fast. Yeah, there are a
Okay.
few other ones.
Okay.
Yeah.
Yeah, so I don't know that there's any other ones that I use regularly that wouldn't also be used elsewhere. So I didn't include anything else.
Okay. Great. The last few slides were the specific clinic questions. I don't know, Amanda, if we needed to go over that and present that today.
No, I don't think so, because it was basically Sarah just getting the lay of the land of what they wanted to name the rooms.
Okay.
If they wanted clinic pools, which is like the message center pools. Which I don't believe we were just gonna do a pool for the clerk, and then a pool for the providers. And since you work without other physios, probably doesn't require a pool of
Okay.
like where all the messages get put together.
Mhm.
So that's probably not applicable to you. And then there was going to be a pool for the case conferences so that everyone
okay.
at the case conference involved can see those. The clinic flag, that's again the ability to follow a patient if they're being admitted throughout the hospital.
Okay.
So it basically flags if the patient's coming in to a Cerner site, that the patient maybe has been admitted or they're in ED.
Okay.
So, and the clinic has opted to do the clinic flag, so that'll be built.
Okay.
And then I think that was it, right, Love? Was there any other information on these slides?
Sorry, I'm not sure what I'm not sure I know what pool is.
So a pool, do you ever use Message Center? It's
Oh,
like it's like the email of Cerner. It's like, and a pool is just so that like if you're covering other physios, for instance, maybe all the messages can go to one area so that you can see all the messages. So if you go,
gotcha.
like providers, if they're looking at results for a patient or whatever, and they're covering each other, sometimes it's important for that to go to a pool so that it doesn't get missed.
Oh, I see. Okay.
So that kind of thing. But if you're not covering anyone, it's not really that handy, if that makes sense.
Fair enough. Yeah. Thank you.
Yeah.
Hmm.
And I think that's it. Did
Yeah.
I cover the key things? Okay.
Mm-hmm.
So it sounds like, Sarah, a lot of, well, all of it is going to either be on paper or auto text. So the
Mhm.
next steps for us is we can mock up those auto texts so that when we come to the next session, we can show you what it would actually look like in the system.
Great.
And make sure that that still works for you. And then the purpose of the next session would be to do more of an end-to-end demo, kind of showing what those auto texts look like, and then what it would look like from the point of receiving the referral to your different clinical documentation pieces, in hopes that that does work. And then if there's any big red flags based on you seeing the mock-ups, then we can discuss it then. But if not, hopefully it'll be pretty good from that point.
Great. And is that tomorrow?
No, I think it's in a couple weeks.
Okay. I think there is a meeting tomorrow.
Yeah, it's a little confusing because you guys have there's a few streams on the project.
Okay. Oh,
So
okay.
there's
So it's a different
like,
one tomorrow.
yeah, there's like the
Okay.
ambulatory stream, which is like we design your overall clinic or clinical documentation. And then there's order sets. They have their own stream and meetings. And then that's specifically for the power plans, which is like your current state PPOs or what the providers are going to use to order, which I don't think you'd have to be involved in.
Okay.
And then there's another stream, which is scheduling. And I believe the scheduling might be the one that's coming up. And then that's just kind of how you, it's usually more the clerk that's involved in that. And since you're not scheduling,
Yeah.
you wouldn't need to go to that session if it is indeed a scheduling session. Dolores, do you know what the next session is for tomorrow? I just want to make sure Sarah doesn't go. She doesn't have to.
Yeah, let me double check. I'm having some Outlook issues, but I'll double check. Just give me a sec.
It says order set gap analysis session.
Oh, okay. So it is an order set one. So,
Okay.
are you going to ever, like, you won't be placing the order sets, that'll be the provider, basically placing the current PPO. I know they said that they don't have one current state, but they would prefer one future state. Are you
Okay.
ever going to be the consumer of those orders? Like, will you ever be the one that has to do something?
I guess they could put a physio order in for me through CST, right? Is that kind of what you
Like
mean?
the referral order, is that what you mean?
Yeah.
Yeah, so there will be a way that the scheduling team is going to do the orders for referring to you to see the
Great.
patient. Yeah, I'm just wondering if it's worth your time to go to that session, to be honest.
Well, maybe I'll log in and then ask them the first thing.
Yeah, I would just say if
Okay.
it's relevant to me, just because you're not going to be the one placing the order, and unless you're going to be the one who's actually looking at those orders to see, it's usually like medications and you know what I mean, stuff like that
Okay.
maybe the nurse would follow, or
Okay.
so yeah, I would just ask in the very beginning of that session, is this relevant to me? Because maybe
Okay.
you can hop off.
Okay, fair enough. Thank you. Not that I love going to meetings, but
No, I know, I just don't want to waste your time if it's
yeah.
not something you're going to look at.
Okay, sounds good.
Hi, everyone. Andre here. So I believe Sarah does not need to be in the meeting tomorrow for order sets.
Okay, thank
Yeah, I
you.
Yeah,
don't
that's
think
what I
she
lean
will-
towards too, Andre.
Yeah, I don't think she will ever use the order sets or any of those orders. It's just for PTs, most of the time it's just the consult or the following up order. Yeah, I don't think it's
Okay.
worth it for her to be there. That's
Okay, thank
my
you.
opinion.
Okay, thanks. So maybe that me and the OT and the psychologist probably all don't need to go, hey?
The psychologist, maybe.
Yeah, the psychologist maybe, yeah.
Yeah,
Okay.
but probably the OT and PT, I would say no. But maybe Dolores, do you mind reaching out to the order set team and just say, we had a session today and we just want to clarify if OT or PT are actually required to go to this session? And then maybe we can just, Dolores, if you could email Sarah today.
Yeah,
and just
sure.
let them know that feedback, and then maybe at least we close the loop, because we're speaking on behalf of them. I still want to make sure they
Yeah,
don't have something important they're waiting on.
no worries. Yeah, I can do that today. No problem.
Okay,
and then
Sarah.
Sarah, I'll just send you an email or a note after I confirm.
Awesome, thank you. That'd be great.
You're welcome.
Perfect. And if they say no, Dolores, to OT, then maybe just include OT on that email too, so they know.
Okay, yeah, I will let you guys both know. And also if the psychologist needs to attend, I'll let you guys know. I'll send you guys all an email on who
Perfect.
needs to attend or not.
Perfect, thank you.
that would be
Because yeah, our
lovely.
OT and our psychologist don't actually work tomorrow, so I think that they might be just trying to,
Come in just for that.
yeah.
Okay, yeah. So let's
I
not
can always
waste
send them a
anyone's
message
time.
if they don't need to come.
Beautiful. Thank you.
Perfect. Thank you for following up on that.
So is there any other questions or concerns, or does that sound like good next steps for you? I think it's honestly going to be pretty straightforward when we show you in the system. I think it's gonna
Yeah,
be
I think
fine.
so. And you know, I just started working at the geriatric rapid access clinic. And so it's kind of similar, like I think. So I don't think it should be too different. Like we made just an auto text for our assessments and everything. So it's been pretty straightforward.
Yeah, perfect. Okay,
Mhm.
yeah, I think with your experience, I think it's honestly going to be pretty streamlined. Hopefully I don't jinx it, but I think
Yeah,
it's gonna be
knock on
fine.
wood.
Yeah.
Mhm.
Perfect. Okay,
Great.
so sorry to have booked an hour. We can
Oh,
kind of
no,
give you a
that's
bit of
okay.
time back.
Yeah.
And then we'll reach out when we have secured the next date for the next session. And hopefully you can attend.
Great. Thank you. Sounds good.
Thanks.
Okay. Okay. Bye.